Folks, our next guest here is just an incredible, smart man from Johns Hopkins Center for Health Security. His name is Amesh Adalja. Amesh, good morning. How are you, doctor?
Good. Thanks for having me.
Yeah, I heard you on the Sam Harris podcast. Very informative. I've seen your TV work. And we just have so many questions, kind of from a sports world perspective, on the coronavirus. And I got to ask you first, right out of the gate, where do you think we are in the disease? Are we in the early stages? Is this the middle round? Is shutting down everything the way Italy has? Is that the move to go? And do you think that's where America's headed here in the coming days?
I do think that America is sort of in the early rounds right now. We've had transmission probably going on at least since January here in local chains that really weren't recognized. And I do think that it's the next couple of days into a week are going to be very critical to understand where we are on what's called the epidemic curve and see if we're on to a trajectory that's hopefully not like Italy or something much different. And I do think that that's why you're seeing a lot of this social distancing now, because we're trying to kind of clamp down on unnecessary contact between individuals to see if we can have some way of blunting this curve. But it's very hard to know because we've had such a difficulty getting people tested for this. And so we're kind of in many ways flying a little bit blind when it comes to knowing where we are on the curve.
Yeah, doctor, I got to start with the testing next. I mean, goodness gracious. I don't want to make it political, but can we figure out how to get on South Korea's level here and start to test everybody quickly? Because, it seems like nobody's being tested in America. And the concern then, of course, is if everybody's tested and everybody panics because they have it, then the hospitals are flooded. I don't know. What do you feel, doctor, should be the strategy here for testing?
We definitely have to make it easier for doctors to order this test. This isn't something that should take a lot of bureaucracy, a lot of paperwork, and a lot of headache for a doctor to order. They should be able to order it on those patients they think merit a test. That might not mean everybody, but it does mean that we need to be testing much mild cases, at least for surveillance purposes, so that we know where this is in the community. And we need to start getting people diagnosed and instructing them to isolate themselves if they don't need to be hospitalized. And this is something that's very simple, and that's probably what's behind South Korea's success, that they were able to identify people and have them self-isolate, and that caused their epidemic curve to be a little bit different. And their case fatality rate is less than 1% there, which I think is reassuring to people. But we need to be able to do that to dampen the panic and really get a handle on what's going on.
Okay, Dr. Adalja, let me ask the most basic question here. And there's a lot of misinformation online, which is frustrating. So if people could put down social media and listen to the doctor here, number one, how is this spreading? I mean, people want to know, when I go to the grocery store, should I wear gloves to handle the grocery cart? When I go to Costco, is it, if somebody's sneezing, how dangerous is that? Can I play basketball? What about hot yoga? Doctor, these are just the basics we're curious about.
Sure. So this is spreading through the respiratory route, meaning through coughs and sneezes that emanate from someone's body. They usually travel about 6 feet before being captured by the force of gravity and kind of falling to the earth. So it's not something airborne like measles, for example. There are risks of touching surfaces that someone has coughed or sneezed on, and that's why we're emphasizing people wash their hands a lot. That's not the main way it's transmitting, but it is one way that you can get it. For each of those activities, you really have to think about your own risk factors, what you might be facing in terms of health problems, what your age is, and then kind of make those decisions for yourself. In general, we want people to start thinking about all of their activities that are non-essential and trying to think, can you modify them to put yourself less in contact with other people? It's not that everyone that gets this is going to get seriously ill, but you don't want the virus to use you as a chain of transmission to someone that might be more vulnerable. So we're trying to get people to social distance as best as they can, but we know that this is disruptive and that there's a cost to social distancing, and sometimes that's hard from a policy standpoint, even from an individual standpoint, to decide what the best action is to take.
All right, we're talking with Dr. Amesh Adalja, Johns Hopkins. Doctor, what about the basics thing like, hey, I get a package from Amazon? It's come domestically, not from China. Is this something where I should wipe it down before I open the package? What about getting my mail from the mailbox? I mean, we don't know if the mailman has coronavirus. Should we be wiping down everything we open from the mail?
I suspect that the risk from mail and from packages is very, very low. And I would probably tell people that's not going to be the way that you get infected. I mean, obviously, you can find studies that show that this virus can remain viable on surfaces, but in most everyday life, I don't think you're going to find those types of things as mailer packages being major carriers for it, or your mailman or mail carrier being the main way that you're going to get exposed to this. It's really coughs and sneezes from other people, and I think that people need to not necessarily become compulsive about all of that stuff, but a lot of common sense with touching common surfaces like countertops. That type of thing is what we're really talking about, less so the packages in the mail or anything like that, although there's going to be panic and people are going to do that, and it's going to be impossible to stop people from doing that. But I don't think that's a major risk that I myself am worried about, and I'm going to go check my mail as soon as I get off the phone with you.
All right, doctor, how about this one? We have a lot of young parents listening to this show who have kids playing youth sports such as baseball or soccer. Currently, the leagues are shutting down for a week or two to assess things. But, you know, if you're playing youth baseball and someone grabs a bat and goes to, you know, the next guy up grabs the bat, like, is that a way it could be transferred? Or is, you know, do you recommend holding our kids out of youth sports for a few weeks?
Well, I think some of those decisions are being made for you because there's a lot of guidance going on from these the leagues, and I was actually on the NCAA panel regarding March Madness, the coronavirus task force. So there are a lot of things that we're trying to do, and one of them is not necessarily transmission between sports players, but we're congregating people together at games, and we know that large gatherings can be vectors for spreading a virus. So that's why we're trying, at least in these next 2 weeks, to try and see if these activities have an impact and see where we are in terms of the outbreak. I do think that there is probably minimal risk from using a baseball bat that somebody else has used. Again, it's important to wash your hands and touch your face less, but I think that these household objects are probably less likely responsible for the spread than actual symptomatic individuals coughing or sneezing on each other.
All right, doctor, this is a perfect transition. You just said you were on the NCAA panel, the coronavirus task force. Let me ask, was there consideration of postponing the tournament or versus canceling it outright? Because a lot of the, obviously the seniors and the teams are devastated. But was it cancellation or nothing?
No, if you look at our decision making, our first decision making was to have the tournament without fans. And then what happened was you saw multiple different schools just closing and sending all their students home. And remember, these athletes are students too. So if those colleges were actually not operating, it became less likely that this type of thing would be feasible. And we in setting an example regarding mass gatherings, and that the Final Four tournament is a major mass gathering, there was no desire for the NCAA to really put people at risk, put fans put players at risk, put officials at risk, put media people that might be there, and we didn't want to contribute to the spread of this virus. So it was the best decision to make based on where we are, and I think that these things are definitely hard decisions to make, and there's a lot of disruption that occurs, but we really had to think about what would be best for the spread of this virus and trying to contain this virus. And a mass gathering like that could really be a major advantage for this virus, and we did not want to be part of that. And I think that was the best decision to make, given where we are in this outbreak. All
right, doctor, just two more. Let's pivot from college to the NBA. So, obviously in college basketball, colleges stopped operating. There's none of that in the NBA. Do you believe we will be back in 30 days, or have you been asked anything by the NBA regarding the coronavirus? What are your thoughts on professional basketball here in America?
I wasn't involved in any of the on any of the NBA decisions. I think that has to be made. It's going to be context driven. So we need to see where we are in the outbreak curve and what's going on in our communities, what we know about the severity of the disease. I think we'll know a lot more even by a week from now, and I think that will help make those decisions. So I don't want to say whether or not when it will be right to have these types of mass gatherings. I think for the next couple of weeks, though, it makes sense to try and see if we can get some control of this virus by trying to do as much as we can voluntarily to limit the opportunities the virus has to spread, and we'll have to revisit this.
All right, doctor, final question. So the big talking point is, hey, if you're young, you're going to be fine. If you're a kid, you're going to be fine. It's only the old people to worry about. And the stat that keeps getting parroted out, I'm not sure where it came from, is that 80% of the cases in China were mild. Can you just speak to that and the age demographic breakdown? What's true, what's false, what and all that?
Sure. So it is true that 80% of individuals who get this seem to have mild disease, and it might be even higher because the Chinese data might be skewed. But that doesn't mean that it's nothing. It does mean that you're going to be out, that you're going to have a severe cold. And the important thing is that you can transmit that on to other people who may not have that same risk profile that you have. So that's why it's important to really focus on that 20%, which tend to cluster in the elderly, which tend to cluster in people with other medical conditions. And we're trying to not allow the virus to use us as a transmission belt to them. That's why we're worried about this, because if you do see, case fatality ratios of 1%, that can be tremendous because we know that our hospitals operate near total capacity all the time. And that's what we're really worried about, is our hospitals not being able to cope with the patient surge that they're going to get. And that's happened even with a virus that may have less than 1% mortality, because if there is a large demand for ICU beds and hospital beds that we don't have, that's going to really put the U.S. healthcare system in crisis. And that's what we're worrying about. We're trying to really not worry so much about the mild cases, but the fact that those mild cases can get to people that are severe and that are going to use hospital resources and require a lot of care to get through this, and that's going to be too much for many hospitals to bear. That's what we're worried about.
Thank you very much, Dr. Amesh Adalja. Great stuff. He's a Johns Hopkins Center for Health Security Senior Scholar. Doctor, good luck, and thank you very much.